Hello, friends. We know that maintaining our blood sugars within recommended range is very important for our health. While in the short term, it helps us avoid the immediate complications like hypoglycemia and DKA, it also avoids various body organ systems damage in future. In today's presentation, we will be discussing about the various long-term complications related with type 1 diabetes and the steps to prevent them. All of our body's systems are designed to work optimally within a certain internal bodily composition. While persistent elevation of or wide fluctuations in the blood sugars are detrimental for most body systems, some organs like kidneys, eyes, nerves, and blood vessels are particularly more prone to get damaged than the others. In the situation of poorly controlled type 1, while the damage in these organs may initiate right from the first few years after the onset of condition, it may progress to clinical disease if the optimal control is not maintained over next few years. In fact, if good control is maintained later during the course of the disorder, even some of the established damages are expected to recover towards normal. Hence, it is important to put genuine efforts towards good control at every age and duration of diabetes, so that along with having an optimal lifespan, we also live life to the fullest. So let's see what questions will be asked in today's Who Will Be Type 1 Genius?
Hello and welcome in today's episode of Who Will Be Type 1 Genius. So the topic of today's quiz is long-term complications associated with type 1 diabetes. Our contestant for today is 30-year-old Mira. She definitely qualifies to answer our questions since she has been living with type 1 for past 25 years. So welcome, Mira. In the first question, you have to identify the organ which is most sensitive to the long-term damage in anyone living with type 1. Options are liver, heart, brain, or kidney.
Sir, it should be the kidneys. Some other sensitive organs are eyes, nerves, and blood vessels.
Correct answer. Here comes the next question. In a 9-year-old child who has been recently diagnosed with type 1 diabetes, when should we start screening for long-term complications? Right away, at 11 years of age, at 19 years of age, or wait for some problems to appear?
If we wait for the problems to appear, then it will be too late. The correct answer should be at 11 years of age. In fact, it should be started at puberty or from age 11 years, whichever is earlier, with 2 to 5 years diabetes duration.
Perfectly right. So now that you have started screening, in the next question you have to tell that how frequently should it be repeated? Options are twice a year, once every 2 years, or it is variable for different parameters?
Well, it is variable for different parameters. While with the normal results, screening for kidney and nerves should be done once a year. For eyes and blood vessels, it should be done every 2 to 3 years.
Your answer is correct. In next question, identify the problems a person can face due to long-term complications of type 1. Blindness, pain, and loss of sensation in hands, paralysis, kidney failure, or all of the options are correct.
Sir, it is unfortunate, but all of the options are correct.
Yes, Mira. It is unfortunate that despite these dangerous risks, often people choose to remain careless towards the diabetes control. However, your answer is correct, and we are moving to the 5th question. With good diabetes control in type 1, what all benefits are expected for the families in long term? The options are longer life, better quality of life, reduced expenditure on treatment, or all of these are correct?
Yes, all of these are correct. Having a good control is important right from beginning.
Correct answer again. So Mira, do you get your complication screening regularly?
Yes, sir. Now I do. However, during the initial few years of my type 1 journey, my family was not aware of its requirement, as we were not consulting a trained medical professional. We started screening when I turned 17. Unfortunately, it was identified that my kidneys are getting affected, but later, with regular good control, that damage has recovered and my all organs are working fine now.
That's great! I am sure that with your inspiration, several families will become serious about good control and complication screening. Okay, let's proceed to the 6th question. What is not true regarding the urine albumin test done for the screening of kidney damage among the options? Instead of full-day collection, it can be done on a one-time passed urine sample. First passed urine in morning is preferred. It should be avoided during menstrual periods, or even a single abnormal report indicates the kidney damage.
Sir, rest of all are correct. The last option is wrong. Only if at least 2 of the 3 tests done over 3 to 6 months come positive, only then it is considered as increased albumin excretion.
Exactly! It is important for everyone to know it to avoid unnecessary anxiety just looking at single abnormal test report. It may be transient, and next reports may come normal. Okay, the next question is about eye checkup in persons living with diabetes. You have to identify the wrong option. The checkup is same as that for making spectacles. It should be done by a trained eye specialist. It can be done by taking retinal photograph, or it should also include screening for cataract.
Well, this question covers a common myth about eye checkup. Many families think that if the eyes were tested during the process of making new spectacles, then the screening for complications is done. However, these are entirely 2 different types of eye checkups. Hence, the first option is wrong.
Again, a correct answer! Again, in the next question, you have to identify the wrong statement, but this time about type 1 related nerve damage. The options are pain in fingers could be an early sign, numbness in fingers is usually a late sign, testing involves costly procedures, or testing doesn't involve any costly procedures.
The answer has to be from the last 2 options since they are contradicting each other. Yes, the screening for nerve damage is done clinically in the consultation room itself. It doesn't require any special procedure.
Yes, you said it right. Let's move to the 9th question. According to the literature, which of the option is not an additional risk factor for type 1 related complications? High blood pressure, regular isotonic exercises, obesity, or heart diseases in family?
Of course, regular exercises are protective. Why should they be a risk factor for complications? As such, common sports comprise of a variable mix of isotonic and isometric exercises. This is the wrong option.
Very true. So moving to today's last question, which can give you the title of Type 1 Genius today. You have to identify the incorrect statement in the context of pregnancy in a person living with type 1 diabetes. Caution should be exercised in using certain medicines used for kidneys during pregnancy. Eye problems may worsen during pregnancy. Regular complication screening should continue during pregnancy. Or pregnancy should be avoided due to risk of complication.
Why should the pregnancy be avoided? Both pregnancy as well as nursing the baby is totally safe in type 1, provided the control is good and optimal medical supervision is there. I too have a 3-year-old son, and I am so happy being his mom. So, this is the wrong option.
Yes, this is a wrong option. Yours is a right answer, and for sure, you are a type 1 genius.
So, it is certainly important to maintain good control and screen for complications in timely manner. Though certain treatment options are available if these complications develop, but why to let them develop in the first place? Hope you got answers to your several questions about type 1 related complications from this creation today. So, we shall meet soon with our next presentation. Till then, bye-bye.